I'm good. How are you?
Good. So I'm going to close the door. My name is Laney. I'm going to be your student nurse today from LSUA, and I'm going to provide you a little bit of education. Is that okay?
Yeah, that's fine.
Okay, so I'm aware you have a previous history of falls. Is that correct?
Yes, I do. I'm tripping and I'm falling over everything.
Oh, goodness. Well, so I've looked at some previous quality improvement studies, and these are just studies to help prevent or reduce the risk of something happening. So these quality improvement studies on falls help prevent, and they look at ways that may prevent falls or reduce the risk of them happening here at the hospital and when you go home.
Okay.
Okay, so one of the few things I want to talk about with you is physical therapy. Do you attend that?
I don't.
Well, it's very recommended. It's one of the top things that they notice prevent or reduce the risk of falls. This helps to build muscle strength and balance, which is what we want for you, so you can become more independent when walking.
Right.
And we want you to be more independent before you go home.
Okay.
We're always willing to help you. We want you to use your call light, and we want to help you walk wherever you need to. But we also want you to build that muscle strength before you go home.
Okay.
Okay. And one of the next things that I wanted to talk about is taking many medications. So I noticed in your chart that you take quite a few.
I do.
Yeah, and so these certain medications can have certain reactions with each other. So taking a certain medication with another could make you dizzy or sleepy, and that's not safe when you're walking somewhere.
Mm-hmm.
It can make you fall, trip. It's just not safe.
Yeah.
So if you know you have to go clean, or you know certain medications affect you in a certain way, I would just hold off on taking them if it's okay with your doctor.
Okay.
Until you know it's safe to do so, or hold off cleaning or whatever it may be. Just do it when the time's right.
Okay.
Okay. And then the last thing I want to talk about is one of your medications specifically is an antidepressant. It just is something to help with your depression, and just one of the side effects is orthostatic hypotension. Do you know what that is?
No.
Okay, so orthostatic hypotension occurs. It's just basically when you're switching positions too quick, your blood pressure tends to drop, and that's a very common side effect of one of the medications you're taking.
Mm-hmm.
So one of the studies showed that when you're switching positions, to do it slowly.
Okay.
So if you're sitting up out of bed and you're about to get out of bed, sit up slowly. Let your legs dangle off the bed for a little while. See if you're getting dizzy, or if you feel lightheaded,
Mm-hmm.
or you feel like you're about to pass out maybe. Just wait it out for a minute to see how it's affecting you, and then if you feel safe to do so, to stand up.
Okay.
And then do that over again just before you start walking. Stand there for a minute and see if you start to feel dizzy, lightheaded, whatever it may be.
Okay.
Okay? Because we don't want you to start walking and then you fall, or,
Yeah.
you know?
And I do fall a lot, so.
Yeah. So that's just something I want you to be careful of, since it is a common side effect.
Okay.
Okay, so what can you tell me about attending physical therapy? What can it do for you?
Like you said, it can help with my balance and my strength.
Mm-hmm.
And, you know, just getting the help that I need when I need to get up, and just not getting up on my own, because I feel like when I get up on my own, I just always got to trip on something, or I'm feeling dizzy and I'm going to fall.
Okay.
So I think physical therapy would help me.
Yeah. And what can you tell me about orthostatic hypotension?
So you told me that is when my blood pressure drops when I get up too quickly or move too quickly. So I noticed that does kind of make me
Dizzy.
Yeah.
So just make sure you do it slowly, and it's
Okay.
not guaranteed it's going to happen, but there is a chance, so you just want to be careful.
Okay.
Do you have any questions for me?
No.
All right, so if that is it, I'll thank you for letting me do this with you.
You're welcome. Thank you.
Let us know if you need anything.
All right.
I'll perform hand hygiene and exit the room.